It's time for today's medical alert. And did you know nearly 1 in 8 women will develop invasive breast cancer over the course of her lifetime? Dr. Scott Berry is here with us today to discuss different surgical options if you or a loved one finds themselves face to face with this disease. Thank you so much for being with us today. Once the diagnosis is made, how soon should a patient see a surgeon?
So with surgical care readily available in Jackson, we're actually fortunate. The surgeons are typically involved fairly early in the process. The way it works here is the primary care provider, either the gynecologist or the family practitioner or nurse practitioner, will get a mammogram. If it's abnormal, we'll bring them to the breast center at Baptist, and actually that's when they first meet the surgeon. So we help with the workup and the evaluation for breast cancer.
Now, when it comes to the different stages, how is that diagnosed? How do you find out which stage and then choose a surgical option after you determine at what stage the cancer has progressed?
That's right. So the surgical options are essentially breast conservation surgery versus mastectomy. When we talk to women about surgery, we divide it into two parts. What most women don't know is that a personal history of breast cancer actually increases your risk to almost 30 or 40%. So when we do surgery for cancer, we need to think about treating the cancer we have now, but also about managing the future risk. Our operation, whether we do a lumpectomy where we just remove the cancer itself, or whether we do a mastectomy where we remove the entire breast, depends on whether the woman wants to try to preserve her breast tissue. If we just do a lumpectomy, you have to follow up with the radiation to decrease that 40% risk down for future breast cancers. When we go to the operating room, we sample the lymph nodes, which is the most important thing to know. And that's actually so it's after the operation when we actually stage a woman and we'll know what stage she is.
What comes first? Surgery, chemo and radiation, if it's determined she needs all three.
Sure.
So where would you go first?
Yeah, so it kind of depends on exactly what you have. If you choose breast conservation surgery, in general, that will be followed by radiation treatment. If you choose a mastectomy, and that's a personal decision, because medically, the cure rates are the same, whether you do lumpectomy, radiation, or you do mastectomy. Chemotherapy usually will follow after the healing has occurred after the surgery. There are certain high-risk groups, though, young women with small or with large tumors, women with triple-negative breast cancers, or women with genetic mutations who may actually get chemotherapy before they get their operation.
Wow. Now, I know that at Baptist Center for Breast Health, you actually offer the results while you wait. Now, if there is a finding, then they can go right over and see a surgeon. You have everything pretty much there without having to wait. Can you explain that process?
Sure.
And I know, because it can be terrifying. If you get a mammogram on a Friday and you've got in the waiting process, it can be just torment.
That's right. It's awful. And so what we tried to do is we tried to diminish the time between the time a woman gets notified that she has an abnormal mammogram and the time that we actually get a diagnosis. So when a woman has an abnormal mammogram, we'll bring them to the breast center at Baptist. They'll actually see a surgeon, be evaluated, clinically evaluated, and then we send them right across the hallway to our radiologist. Our radiologists then have the go-ahead and do further evaluation, work up additional views, and proceed directly to biopsy. Usually within 48 hours we'll have that result back. We call the women and let them know, and easily within a few days we're talking about their treatment plan.
It's amazing. Dr. Scott Berry, thank you so much for being with us and for the great information. We appreciate it.
Thank you.
And we will take another look at your first alert forecast in just a moment. Don't go away.